Hello friends, I'm Dr. R.K. Dua. I welcome you all to my channel. So in my last video I have discussed about the diabetes mellitus. In my series medical problems and your health, today I will discuss about hernia. So what exactly is the hernia? Many times you have seen the patient in the inguinal area or the abdominal area. So they have bulge. So that bulge sometimes in small children or in newborns, that bulge is present in the inguinal area. So that bulge, you can say, is just a defect in the abdominal wall through which the content of the abdomen protrudes out, and because of the intact skin they bulge out through the skin. So that bulge is present when, in case of small children, when the child cries or strain for defecation. In case of adults, that hernia may be a part of congenital defect or may develop because of the aging process when the muscles are weak and the normal tracts which remain closed, and all of a sudden there is a gap develops because of high pressure in the abdomen. Gaps develops between the muscle fibers and the inner contents starts pushing out. So let me explain you with diagram. If I draw this, suppose this is a building and here is small thing. If this brick is removed because of any process, so what will happen? So it will look like this, and this is your skin, and here are your intestines and fatty omentum. So what will happen? When the pressure increase, the part of intestine will go through this defect and it will be pushed here, and it will like this, and this is your skin. So this is your part of the intestine. So as you know, through difficult path we can negotiate, but with difficulty. When the window or the door is large, we can easily go to and fro. So similarly, in this case also, when the opening is small, what happens? Because of sudden pressure, when intestines are pushed through a small opening with pressure. So when these intestines are pushed through a small opening, so they become constricted. There is a constriction ring at the wall of the intestine. What will happen immediately? Because of the constriction, blood supply will be hampered. So initially there will be arterial supply will be there, blood, but the venous supply will be hampered, and there will be retention of the fluid in the walls. So what will happen? Edema will develop. So now suppose this is your intestine along with the omentum. So what will happen when there is pressure from here and pressure from here, and there is decreased venous supply? Venous supply will be decreased, so there will be more swelling, and now the more constriction, and ultimately your gut may become black, or what we call it gangrenous. So this is the main danger of the hernia. If this opening is too wide, intestine will go when you strain, when you stand up, and when you lie down, these intestine will go down. So you will just have some dragging sensation, heaviness, and chances of this kind of obstruction are less, though it can occur. But you cannot say that it in wider opening these are totally absent. So the main only the main relieving factor in case of large defect is that chances of obstruction, sudden obstruction, are very low. So what we can do in this? So now if I draw the skin over it, it is like this. So what exactly if surgeon gives you the suggestion that you must undergo surgical procedure? So what exactly we do in surgical procedure? We just in this step, if you are able to see this and this one, the basic procedure, whether we do the laparoscopically or we do the open surgical procedure or we do with the robotic surgery, the procedure remains the same. That is, the first we reduce these intestines, we reduce this intestine, and what will happen? This defect is there and here is the skin. So we have to close this defect because this is a muscular defect. If it is small, we can suture it, approximate, and we close the defect. So depending upon the procedure, we can apply the mesh here inside through abdomen in laparoscopic procedure. In open procedure, we can also put a mesh from here. Mesh means nylon mesh, because the hernia occurs because there is a defect, there is a weakness. So now we have placed a nylon mesh, and this nylon mesh will give strength to the already weakened muscle. In case of small children, there is a congenital defect. So that congenital defect, we just have to, in this case, we just reduce the intestine, this is the skin, and we close this defect by approximating the muscles. We don't have to do anything. We don't apply mesh. So in this case, we can repair the hernia. So the main problem is that many times when we suggest to the patient that you have to undergo surgical procedure, so they find it very difficult which one to choose. So in case of elderly people, in case of adults, we strengthen the muscular defect with nylon mesh. So there are various types of nylon mesh depending upon the which kind of procedure we are doing. But in case of neonates, small children, there is congenital defect. We just have to reduce the content of the hernia. That is, sometimes omentum is there, part of the intestine is there. We reduce the content into the abdominal cavity and then we close the defect, and over that we close the skin. This way we can do the surgical procedure and relieve the patient of hernial problem. So sometimes patient is reluctant that I will not undergo any surgical procedure, treat me with medicine. So as such, I have already told you, body is just like any other material in the world. If you have broken window or broken wall, the two bricks are missing, so you cannot close that defect with a piece of paper, cardboard, or a piece of bed sheet. There you have to replace the bricks. You have to fix the bricks with cement. Similarly, in our case, though we cannot have such kind of muscular tissue that we can close the defect with that, we just approximate the muscular margins, if these are approachable, and we can easily approximate the two walls just like this is a defect, and without any tension. If tension is there, ultimately, even if we are able to close it, and ultimately after few days it will come out, and the sutures will cut through the muscular walls. So this way we can do the rectification of the hernia. So there is as such no medical treatment for the hernia. Only thing is that you can take some time to decide, but that too when your surgeon suggests that you can wait for few days, but not longer than that. Thank you very much, and don't forget to subscribe my channel to know more about your diseases and your problems, and to remain comfortable. Thank you very much.